Today's topic is Lyme disease. Lyme disease is a bacterial infection primarily transmitted to humans through the bite of infected black-legged ticks, also known as deer ticks. The bacteria responsible for Lyme disease is called Borrelia burgdorferi, and in some parts of the world, another closely related bacterium called Borrelia mayonii can also cause the disease. These ticks are usually found in grassy and wooded areas, and they pick up the bacteria by biting infected animals, particularly mice and deer. When an infected tick bites you, it attaches itself to the skin and begins to feed on blood. The tick secretes saliva that contains substances to prevent blood clotting, reduce pain, and suppress the immune response, which helps it stay attached and feed unnoticed for days. During this feeding process, the Borrelia bacteria in the tick's gut can migrate to its salivary glands and be transmitted to the human host. This process typically takes 36 to 48 hours. That's why it's crucial to check for ticks after spending time outdoors and remove them promptly. Once inside the human body, Borrelia bacteria begin to multiply and spread. They can move through the bloodstream to various tissues, including the skin, joints, heart, and nervous system, leading to the diverse array of symptoms associated with Lyme disease. The bacteria also have evolved mechanisms to evade the immune system, allowing them to persist and cause ongoing infection and inflammation if not promptly treated. Symptoms of Lyme disease. The symptoms of Lyme disease can be quite varied and often mimic those of other conditions, which is why it's sometimes called the great imitator. The symptoms are usually divided into 3 stages: early localized, early disseminated, and late disseminated Lyme disease. In the early localized stage, which occurs days to weeks after the tick bite, one of the hallmark signs is a rash called Erythema migrans. This rash often starts as a small red spot at the site of the tick bite and expands over several days, sometimes forming a distinctive bullseye pattern. However, not everyone with Lyme disease develops this rash. Alongside the rash, you might experience flu-like symptoms such as fever, chills, headache, fatigue, muscle and joint aches, and swollen lymph nodes. If untreated, the infection can spread to other parts of the body, leading to the early disseminated stage. This can happen weeks to months after the initial bite. Symptoms in this stage might include additional erythema migrans rashes on other parts of the body, severe headaches, and neck stiffness due to meningitis, which is inflammation of the membranes surrounding the brain and spinal cord. It can also cause facial palsy, which is loss of muscle tone or droop on one or both sides of the face, and also pain and swelling in the large joints, such as the knees. You might also experience heart palpitations or an irregular heartbeat, a condition known as Lyme carditis. In the late disseminated stage, which can occur months to years after the tick bite, if the infection is not properly treated, symptoms can become even more severe. This stage can include arthritis with severe joint pain and swelling, particularly in the knees. Some people might also experience chronic neurological complaints, such as numbness or tingling in the hands or feet, problems with short-term memory, and speech issues. So, what do these symptoms actually feel like? Well, the flu-like symptoms in the early stages can be pretty debilitating, making you feel exhausted and achy all over. The erythema migrans rash might not hurt, but it can be alarming to see a large, expanding red area on your skin. The neurological symptoms can be particularly distressing, with facial palsy affecting your ability to smile or close your eyes, and the cognitive issues making it hard to concentrate or remember things. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of Lyme disease. Diagnosing Lyme disease can be tricky because its symptoms overlap with many other conditions. If you suspect you have Lyme disease, it's important to see a doctor who will start with a thorough history and physical examination. They will ask about your symptoms, your exposure to tick habitats, and any known tick bites. The characteristic Erythema migrans rash is often enough for a clinical diagnosis in areas where Lyme disease is common. However, not everyone develops the rash, and in those cases, blood tests are usually necessary. The most common tests are 2-step processes that detect antibodies to the Borrelia bacteria. The first step is an enzyme-linked immunosorbent assay test, which, if positive or inconclusive, is followed by a Western blot test. These tests can help confirm the presence of antibodies against the bacteria, but they are most reliable a few weeks after the infection, when the body has had time to produce enough antibodies. In some cases, particularly if neurological symptoms are present, a lumbar puncture, also called spinal tap, might be performed to check for signs of infection in the cerebrospinal fluid. This can help diagnose Lyme meningitis. Treatment of Lyme disease. Treating Lyme disease typically involves a course of antibiotics. The specific medication and duration depend on the stage of the disease and the symptoms. For early-stage Lyme disease, oral antibiotics like doxycycline, amoxicillin, or cefuroxime are commonly prescribed for 2 to 3 weeks. These antibiotics are usually very effective at eliminating the infection and preventing further complications. If the disease has progressed to the early disseminated or late disseminated stages, a longer course of antibiotics might be necessary. Intravenous antibiotics, such as ceftriaxone or penicillin, may be required for those with severe neurological or cardiac symptoms. These are usually administered for 2 to 4 weeks, depending on the severity of the symptoms. It's worth noting that even after successful antibiotic treatment, some people might continue to experience symptoms like fatigue, pain, or cognitive difficulties. This condition is often referred to as post-treatment Lyme disease syndrome, PTLDS, or chronic Lyme disease. The exact cause of PTLDS is not well understood, but it's believed to result from residual damage to tissues and the immune system. Treatment then focuses on managing symptoms, as extended courses of antibiotics have not been shown to be effective for PTLDS. Prevention of Lyme disease. With Lyme disease, prevention is key. When spending time in areas where ticks are common, such as wooded or grassy areas, it's important to take some precautions. So, wear long sleeves and pants, tuck your pants into your socks, and use insect repellent that contains at least 20% DEET. After coming indoors, check your body for ticks, paying close attention to areas like the armpits, groin, and scalp. If you find a tick, remove it promptly using fine-tipped tweezers, pulling upward with steady, even pressure. If you do get bitten by a tick, don't panic. Remove it as soon as possible and clean the bite area with antiseptic. Keep an eye on the bite site and watch for symptoms of Lyme disease over the next few weeks. If you develop a rash or flu-like symptoms, see a doctor right away. At the end, living with Lyme disease can be challenging, especially if you're dealing with chronic symptoms. But it's very important to work closely with your doctor to manage your symptoms and maintain your quality of life. Now, we want to hear from you. Do you or someone you know have Lyme disease? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.